what makes the face naturally look more attractive?
All the features of our face are interactive, they are interconnected to each other. All of us are unique. So it's not only about the golden ratio. If you are blessed with good genes and good features to begin with, it's easier for you to reach a certain level of improvement with plastic surgery.
When do you decide when a patient actually needs fillers or versus just a better skin quality treatment?
Overfilled faces, overfilled lips, Botox not injected in the correct muscle groups. That is the common mistake that a lot of our celebrities are also still doing. Primarily as a standalone treatment, I don't think non surgical treatments have the potential to reverse the signs of aging.
And how do you explain the difference between a subtle change to an overdone look?
Facial symmetry is the basis of all plastic surgeries.
Hello everyone, welcome to another episode of Cosmetic Tales with Dr. T. So today we are going to discuss about how to make your facial feature more attractive by surgical and non-surgical procedures. So we all know that festive season is here and everyone wants to look their best. So let's understand the golden facial ratio, enhancing your facial features and the thin line between enhancement and overdoing it. So let's get started. So what makes the face naturally look more attractive, and are there any universal proportions or is it cultural?
Face has something called as the golden ratio, which means that each aspect of the face has a balance, and all the features of our face are interactive, they are interconnected to each other. Of course, there are ethnic differences, there are cultural differences that people do have, but more or less, we do follow certain important landmarks. Like the face is divided into three halves, and all the three halves has to be proportionate. Vertically also, face can be divided into five portions, and each portion has to have a particular width or a particular dimension. But having said that, I also feel that all of us are unique, and all of us are have our own individuality. So it's not only about the golden ratios or golden proportions, because then everybody would look just the same. It is also about understanding what a person needs, and then to be able to make a kind of a customized treatment plan for each person.
So, how much of a facial attractiveness is because of genetic and how much we can improve?
So genetic characters are very important, because genes are what determines the basic structure, the bony structure or the type of skin that you have. All of this is determined by our genes. But having said that, now science is at a level, or there are so many advancements that we have, that we can work on all components of the face. We can work on the bone, we can work on the muscle layer, we can work on the skin and the fat. So most of the features of our face can definitely be altered. But genes are what you start with. So it also means that, in terms of the outcomes that one can have, if you are blessed with good genes and good features to begin with, it's easier for you to reach a certain level of improvement with plastic surgery. And if you are not blessed with good genetic features to begin with, maybe you'll need more work, more surgeries to reach that level.
Can good skincare, lifestyle, or diet alone can make you look more attractive, or you might need some surgeries?
So a good lifestyle and sleeping on time, drinking plenty of water are basic prerequisites for any individual. And it's not only to look good; it's also to improve your health, to improve the kind of skin that you're going to have as you age. So yes, lifestyle is important, and we all should have a healthy lifestyle in order to maintain the features that we have.
Which non surgical treatments give you the most noticeable yet natural result?
Oh, there are plenty of non-surgical treatments, and each of the treatments can improve a certain aspect. Like for skin care, we now are doing a lot of exosome treatments, which are quite effective. I've seen dramatic improvement in under eye dark circles, for example, with this exosome treatment. There are, of course, other procedures such as micro Botox, and then now we have skin boosters, which really hydrate the skin and help us remove the fine lines and wrinkles. There are certain medifacials such as the Korean glass facial, which makes the skin look absolutely like baby soft. So there are several non-surgical treatments. And yeah, it's the assessment is more important.
When do you decide when a patient actually needs fillers or versus just a better skin quality treatment?
So fillers again are of different types. They are all made of hyaluronic acid, but the composition is different. So there is something called as a G prime, which means the cross-linking of hyaluronic acid is different. What it means in simple language is that for thin areas such as the under eye, you should have fillers which are thinner in consistency, and for thicker areas such as the cheeks or the chin, or where you really want to lift the facial tissues, you need thicker fillers which have a higher G prime. So it's like a palette of different types of fillers, and we need to mix and match depending on what areas require to be worked upon.
Are there any common mistake which people make with Botox and fillers that can throw off the facial harmony?
Yeah, yeah, all the time. I see so many mistakes all the time. Overfilled faces, overfilled lips, Botox not injected in the correct muscle groups. So, see, botulinum toxin is to be injected in specific muscle groups, and if you don't know the dosage or you don't know where to inject it, it can cause asymmetries. It can cause imbalance to the face for sure. Same with fillers. If you inject a thin filler in thicker areas or vice versa, then fillers can give lumpiness, unevenness, and they can really disturb the facial harmony.
So why celebrities and young peoples are actually dissolving their fillers nowadays?
Nowadays, the trend is to look more natural and to go for treatments which maintain the natural look. There was a era, I would say 8 to 10 years ago, where everybody was just injecting fillers in their face. After having done fillers for 8 10 years, people are now experiencing several complications such as overfilled faces. Then there's a term called as a pillow face. It's basically due to overfilling the face with fillers. So sometimes what happens beyond a certain age, you need to opt for tightening procedures and not keep overfilling loose areas of the face with more and more volume. That is the common mistake that a lot of our celebrities are also still doing, and that makes the face look puffy. It makes the face look unnatural, and they are not able to emote. The face just looks frozen, and that is not how a natural face should look. So the trend, even in the Western countries these days, is to dissolve the fillers that they have already been doing and go for more natural treatments which don't distort the facial features, and at the same time they make the face look more youthful and attractive.
So what's the role of these skin tightening treatments or collagen boosting facial in restoring the balance?
So, skin tightening treatments and collagen boosting treatments are very good, but I would say they are mainly for maintenance. So, if you have already done something to tighten the face and then you opt for these treatments, it helps you maintain the results of your treatment. Primarily, as a standalone treatment, I don't think non surgical treatments have the potential to reverse the signs of aging. You do need a little bit of nip and tuck to tighten the face.
So when do you suggest surgeries like rhinoplasty or jaw contouring surgery over non-surgical methods?
There are many aspects to it. One I would say is a uncertain patient. So if the patient himself or herself does not know what kind of look would suit them or what is it that they want to have, then sometimes I recommend them to do fillers initially. They can get to see how it is going to look and shape up, and then once they are sure of that, then 1 year down the line when the filler gets dissolved, they can opt for a surgical outcome. Also has to do with the budget that the patient has. If you try to do many areas on the face, fillers can tend to be very expensive, and then surgeries tend to be cheaper. Even for the chin, if you want to enhance the chin with fillers, you easily need like 3 syringes, and in the same cost you can go for a chin augmentation with implants which is permanent. So there are many factors that come into play. Budget is important. The kind of result that the patient is seeking is important. If it's a very subtle change, then yes, non-surgical treatments can help. But if someone is looking for a very dramatic kind of a result, or for a result which is going to last for several years, then I think surgical alternatives make more sense.
And how do you explain the difference between a subtle change to an overdone look?
So I always feel the hallmark of a successful plastic surgery is where it doesn't draw attention to your face. If you're walking on the street or you're in a mall and people are just looking at you or staring at your face, that I don't think is a hallmark of a successfully done plastic surgery. It should blend with the natural look that a person has, and it should improve the appearance of a person and not look like a overdone thing where the skin is too taut or the muscles are unable to move, the patient is unable to express. These are not signs of a successful plastic surgery, and then that's what we call as the overdone look. Should be
For
avoided.
someone considering surgery, how important is facial symmetry?
Oh, facial symmetry is the basis of all plastic surgeries. And always remember, face is never going to be symmetrical. Even if you measure the sleeves, they are different on both the sides. Similarly, if you draw a midline in the center of the face and divide it into two halves, both the halves are never going to be totally symmetrical. Where asymmetry is noticeable, or you can say that when the asymmetry is more than 20%, that is when you need some kind of intervention to establish symmetry. Don't chase minor asymmetries, they are what make your face look more natural, and it's not something which is harmful. But asymmetries which are in the face, which are visible to people, or draw attention to the face, I think those are the kind of asymmetries we should deal with.
So, what's the typical downtime and the complete recovery for procedures like chin augmentation and cheek augmentation?
Normally, augmentations take around 3 to 4 weeks. Most of the healing of the stitches happens in 1 week to 10 days, wherein the patients have to be on a certain kind of diet to avoid any food particles getting stuck into the stitches because they are all from inside the mouth. And after the stitches have healed, then they are encouraged to start gentle massages. They have to wear compression garments. So, for the complete recovery, it does take 2 to 3 weeks. And the sensory recovery like numbness or getting sensations back again, it takes anywhere from 3 weeks to 6 weeks.
So, how do you evaluate if the nose, lips, cheekbones, and the jawline is in proportion?
So there are certain measurements that we can take, and on the basis of these measurements, we can arrive at certain conclusions. Of course, it also is dependent on what the patient wants. So I normally, when a patient comes for a consultation, especially for a rhinoplasty, I ask patients to bring some photos, and from those photos, we can get a bit of glimpse of what the patient is aiming for, or how subtle a look they want, or how dramatic a result they want. So it's all about understanding what the patient has in mind, and then trying to balance it from the procedures that we have in our armamentarium, and then try to match the two.
And if someone just wants to go for a smaller changes like a tip change, nose tip change, or a just change of the shape of their lips,
Yeah.
can that actually change the face?
Absolutely, 100%. So whenever we look at a person, the nose and the lips, they occupy around 60% of our attention span. So a little bit of tweaking of the nose tip or a little bit of improvement in the volume of the lip goes a long, long way. And I've seen this personally. So many of my patients who were not landing plum roles in the movies, for examples, after they did those subtle changes, I now see them suddenly in the front row, not in the back row where they used to be.
So, do men and women require different approaches when it comes to creating an attractive, natural looking face?
Yes, there are a lot of differences that exist between a male face and a female face. So we don't want to do treatments which will feminize a masculine face, or we don't want to do treatments which will masculinize a female face. So we need to consider what enhancements are required, and then customize them to each aspect of the face.
And the last question, what daily habits like diet, sleep, skincare truly impact facial aging?
So facial aging, gets impacted by everything, right? From the amount of sun exposure that one has, the amount of hydration, of course, the genetic background that a person has. So on top of all of this, if you don't sleep on time, or if you are too much on the screen all the time, and you don't take basic care of your skin, then it's very difficult for the results to really take you to the optimal level. No matter how good a plastic surgery is done, or no matter how good the effect of Botox or facials is, if the skin itself is unattractive and full of blemishes, it's not going to look attractive. So, a healthy lifestyle, eating healthy, exercising regularly, these are very important aspects of any kind of aesthetic regime, and we emphasize a lot on these aspects when a patient comes to us.
So, today we have learned so much about how to make your facial features more attractive and enhancing it by surgical and non surgical procedures. And it does not mean that you have done any surgery that it will completely change your face or identity. It will just enhance your facial features and make it look more attractive.
So, if you like this video, do subscribe to our channel and share this video with your friends.